This is Jasha Connor and Courtney Davis coming at you with episode 3 of Practical Wellness Podcast. Hey, Courtney.
Hey, Jash, how are you?
I'm good. How was your holidays?
It was good. I actually had Christmas Eve and Christmas Day off, but we slammed them full with everything we needed to do. I stayed up so late on Christmas Eve, but we got everything done.
Yeah. I took some time off with the family, too. It was good. It was good. I'm ready for spring now, though. Now that Christmas is over, I need
You're
some
like, all
warmer
right,
weather.
enough of the cold. We're ready. Christmas is over.
It's been negative temperatures up here.
Yeah,
It's
I
been
don't
awful.
miss that at all, but we had a really cold week this week. We're in North Florida, Tallahassee area, and it was 20 degrees, so it was pretty cold for us Floridians.
Is that about as cold as it gets in Florida?
It's as cold as it's been for a while, I think, a few years. Hasn't been that
That's
cold
nice.
in a
I'm planning
long
my
time.
next beach trip.
Yeah, you deserve it. Negative weather, negative temperatures, not my cup of tea. And it's crazy how fast you adapt to the warm weather because I lived in Missouri for 7 years and 20 degrees we were happy about, You're like, oh, it's warm, it's 20 degrees. But nowadays, oof, I can't handle it.
Yeah, I don't think I've ever adapted to Missouri weather than Courtney because I've never said 20 degrees, it's great, I feel great. No,
I always just begging for it to not be negative. So
I need a warm coat.
Well, good. I'm glad you enjoyed the holidays. I'm excited about our episode 3. I can't believe we've already been doing this for 3 months, so it's
I know.
crazy.
This time I'm in CoLab's actual podcast studio. That's pretty awesome. Yeah,
I can't wait to see it. I can't wait to see it. I've seen a lot of it on Facebook, so it's really neat. I actually had a patient come in today, and she goes, "When's your next episode?" And my little heart got all happy, and I was like, "Oh my gosh, you're watching it!" So she was like, "Yeah,
I've had
I'm
them
following
too."
it. So she says she listens to it when she does her walks, and she needs more because she walks every day. And I'm like, "Well, we won't have a podcast every day, not for a while." But I got you once a month, girl.
If only we weren't as busy as we were, we could get it done. But
for sure.
So last time that we was talking on the podcast, we had touch base on direct primary care. And I know that we were talking about we're going to do a little bit of discussion about that today. And so, Courtney, tell us what you're doing and tell us what direct primary care is and what the reason for it is.
Sure. So as not very many people know, direct primary care, also known as DPC for short, is a new healthcare model. And it's actually not that new. It's new to most people, but it's been around for about 10 years. And what the direct primary care model does primarily is it gets you and your healthcare provider in the room, and it makes your decision-making process a lot easier. So you no longer have to fight with healthcare administrations and insurance companies on why or how or when you're going to do something that you and your healthcare provider have decided to do. As we talked previously on healthcare disparities in the last episode, there's a lot of time constraints in traditional healthcare models, which is termed fee-for-service model, which means you show up, you pay your copay, you get your 15 minutes, aka your 7 minutes, and then you're rushed through the system. And because of that delay, you don't get the quality of care that you need. Whereas in direct primary care, we make room for those conversations. So you get to sit down and talk with your healthcare provider, extended appointment times lasting anywhere between 30 to 60 minutes. So that you can actually have a true conversation. We can go over every single thing instead of, oh, we'll take care of 1 or 2 of your complaints today, and you'll have to schedule another follow-up for the next one, or you're not going to feel rushed in direct primary care. So you're going to actually have unrestricted access to your healthcare provider. So how many times has it been, 4:50, and you just picked up your kid from elementary school, and they've got a cough or a sore throat, or even a boo-boo or hurt their ankle, or whatever it may be, and the chances of you getting to your primary care are practically none at that time. They're not going to answer their phone. They're closing in 10 minutes. So when you're a direct primary care member, you have the cell phone number to your provider. So you can call or text or video time or FaceTime or whatever you guys want to call it nowadays. I feel like an old woman right now. Video time. But you can get your healthcare provider on the phone very quickly. And you can discuss what's going on in your life. And even if it's, the weekend, or you end up on vacation and you pull your back out, you have somebody now in your back pocket who not only is your healthcare provider, but they know you. They have had a conversation with you for 30 minutes, 60 minutes at a time. And, when you have space like that, you really get to know each other. And it's not just about your healthcare. They know about your family. They know about your dog. They know what you bought your kids for Christmas. And when you know somebody, you care for them better. And then when you know your provider, you do better because now you feel a little bit more responsible. So it's all really exciting. And we also work with a lot of local labs and radiology companies to lower rates for those who do not have insurance. And direct primary care works really well for those without insurance and even better for those with insurance because we still utilize it. We still utilize the insurance. And what that means is we use it for your labs. We use it for any medications that are sent to the pharmacy. We use it for any referral that you need, whether it's a colonoscopy or you need to see an allergist or a pulmonologist or a cardiologist, we still utilize it. But because we want to spend longer time with you, we have to do a monthly membership mostly. Most DPC clinics are set up on a monthly membership base. Mine is $69 a month, and you get unrestricted access to me every single month.
And it also, you made up a good point about, because it's kind of taken out the administration aspect of it too, because most of these direct primary cares, I mean, look at you. This is your baby, like your business. And you care so much about that business that we're taking out the administration to where, for instance, I know we talked about this last week and I kind of want to bring this up, that the killer nurse, you know, what was the movie called? The Good Nurse?
Oh, The Good Nurse on Netflix.
So it doesn't technically display what healthcare is, right? So, for instance, I don't think that when you watch that movie that gives a correct depiction of what nurses are in healthcare.
Oh,
no,
absolutely not.
That nurse was a psychopath, you know, not to say that anybody can be a psychopath. You know, you can have a random lawyer one day that's a psychopath. But what it did show me in that movie was what administration is. And that is something that flows through every single administration in every big healthcare, you know, because when you watch that movie, it was a lot about administration cover up.
Yeah. And that is all administrations, right? Whether it's healthcare or something else. I mean, the goal is to always reduce risk and reduce the negative press and all of that. And you've seen that even with Dr. Death, which is a big Wondery podcast that came about a neurosurgeon who was hacking up people's backs for decades. And, you know, every hospital didn't just they fired him and let it go. They just didn't want to deal with it at their hospital, but they didn't alarm the public or other healthcare companies to not hire this guy. Yeah. So, and these are all true stories, which is scary, but you're absolutely right. So Forward Wellness is everything I've ever dreamed, and the only person that cares about it more than me is probably my husband because he's tired of hearing me talk about it. But you're dealing with not only, I care because it's my business, it's my name. And so not only do I care about my patients, but every time that you come here, it's not Forward Wellness, it's Courtney Davis. So it's important to me that, and for anybody, any small business owner, and that's why, doing business with local companies and shopping local, it means more because, if I'm working at a multi-billion-dollar, healthcare administration clinic and, it's no sweat off my back when somebody gets mad, right? Mm-hmm. Somebody's mad that they only had 15 minutes and I had to rush them out the door. Like, well, that was the policy. What can I do about it? I just work here. But that's not the situation when you're dealing with, nurse practitioners and physicians and direct primary care clinics. They're there because they want to make a change and they want to actually care for people the way they want to. And it not only benefits the patient, and that's really important to note, it benefits the provider. Burnout, like we talked about, is so high. And it's because of these systems that berate providers to see rapid number of patients in little time and do all these other things that they have to do to satisfy insurance companies to get the correct payment. And so providers are happier. And when you have a happier, doctor or nurse practitioner or physician's assistant or nurse, like when your healthcare team is happier because they enjoy coming to work, that is going to show in so many other places. You always hear the saying, you can't love anybody else until you love yourself. It's the truth with healthcare providers. Like, we have to be happy. Like, it's not fun when you have to see 30 patients a day and they're all mad at you.
No,
so
it's not.
That changes completely with the direct primary care model. So it's really exciting. And if you look around, there's actually probably a few clinics in your area. I know that there's several in Tallahassee. I think 3 or 4. I have some colleagues that do direct primary care in Tallahassee. Her name is Taylor Andrew with Aquarian Clinic. She was one of the big ones first in Tallahassee. And then also Dr. Homan and Kansas Sparks. They do pediatrics and family practice out there. So it's pretty neat.
And even when you're going to find direct primary care, it's still so important that you understand how to find a primary care. Because even, DPC clinics, it's all about, for one, trusting that primary care provider. I think I wrote an article in my blog once about that, and being able to identify if you're going to connect well with the primary care provider, and how to choose one correctly, because it's important that you have, for instance, I had somebody came to me and they go to a direct primary care clinic, but they're begging me to start it because they said, well, I was in there, I was asking these questions, and their response to me was, well, I'm the doctor and I've been to college, so you should just trust me. It's not
a big fan
that's
of
not
that.
how that goes.
Yeah,
no.
And we talked about that briefly. Like, it's about a conversation. It's always about giving informed decision and letting the patient make their decision, and you coaching them through the risk versus benefit and supporting them and advocating for them for what they want in their lives. So, and I think we've lost that a lot in healthcare, especially after the pandemic and the big craze with, who is or who isn't going to get the vaccine, and if you should or shouldn't. It always boils down to a personal decision, whether or not it's right or wrong in somebody else's mind.
Yeah, and it's also an individual decision. It can't be primary. Everybody across the board go get it. Everything needs to be individualized.
Right, for sure.
And
absolutely.
I know that we kind of talked about, I'm going to be doing something a little different down here, and I was thinking about it today, Courtney, because I was in this consult, and I was in a weight loss consult. And, and my weight loss consults are pretty in-depth. We spend about at least 45 minutes. I realized afterwards, I'm already doing what I want to do. I like to bring a functional medicine aspect into it. For one, medication de-escalation. Can we get you off of meds? And not to say that I'm not going to do it in the future. I'm just not there yet, because we're getting our spectrum laser that I'm super excited about, with laser hair removal and all kinds of other procedures that we're going to be bringing in. But what I really love to do, and what my passion is teaching true health. Teaching about, like, how can we get you healthy without putting you on 10 different medications? I don't want to be a prescriber. And I think that's the kidney person in me. Yeah. Because my collaborating physician was just genius in my opinion. But we always wanted people off any medications that we could get them off of, because we know medications are toxic, but we don't get to the root cause. And that's the functional core of weight loss. And that's the functional core of health, is getting down to the root cause. And so I was talking in that consult today, and I get off the phone and I was like, let's say somebody wanted medical health coaching, because that's what I was going to do. I would have said nothing different. My weight loss people are already getting that from me, you know, and it's about teaching you to consider diet as a core health problem. It is medicine.
Yeah,
it should
food
be
is
medicine.
Absolutely. And we see that wholeheartedly, because, you have people who eat poor diets and they have, worse outcomes, I mean, it just is what it is. And so food was the first medicine. I think everybody probably knows that, but we got away from that a lot with the Western medicine. And you're right, everybody prescribes, and there is a purpose for that. There is time and place when you need to be prescribing things, and but we don't need to jump on it as soon as possible.
No. My favorite thing is preventative medicine, and that's exactly what I'm doing. I am doing preventative medicine. When we talk about diet and health, it's just like I said it today in that same consult. I was like, keto is the worst diet that anybody could really do. We still have doctors, though, Courtney, that recommend keto diet.
Yeah, I believe that because it works, but it works for all the wrong reasons. So
it works on the outside, but it's not working on the inside.
Right. And everybody jumps to something that works because that's what patients want. They want something that works fast. And, I talked to one of my patients today, and she's consistently lost, we did the math together, and she has consistently lost 1.4 pounds each week since I started with her, and she's 8 weeks in. And I'm like, this is great. This is a win, like you weren't losing 1.4 pounds each week before we spoke, and of course everybody wants it faster, and you just have to, you have to regroup and kind of focus them in, like, this is a good, like, low and sustainable weight loss is safe, and it's sustainable, and sustainability is forever. So, like, that's the goal. We don't want, rapid weight loss and fad diets and all of that. And then with that it becomes true lifestyle change, and it can be cemented in at a slower rate and more permanent.
But it really proves to me too, because I've had the same, people come and talk to me about this. But when I take the time to sit down and explain just what you said, if you lose too much rapid weight in 3 months, for one, your body can't adjust. You're going to have excess skin. But for two, you're not going to be able to do those lifestyle modifications that's going to be sustainable in the future. That's why when you lose weight too fast, it comes back.
Right. You haven't learned anything.
No, but you'd be better off staying overweight, a sustained overweight for several years than you are to lose weight, gain it back, lose weight, gain it back, lose weight, gain it back.
It's less stress on the system, the body.
Yes. And we're trying to create health. We're talking about health here, not just some quick fix so you can go to the beach next summer. It's more about getting down to the true core of health so that we can give you a better quality of life.
And we want you to get to the beach next summer too. I mean, that's all, that's all real life stuff, and we want that. We want you to be able to get to that, but you got to get to it safely and the smart way. So it's super exciting. And you touched on something, Jasha, that I wanted to bring back. You said, I'm already doing what I'm doing and I love it. And you're right. And you're doing preventative care. And that's where direct primary care, a lot of people are like, oh, it's just primary care, but you get to spend time and have these true conversations about preventative health care while also providing preventative screenings. So really, that's the only thing that you and I are doing different, Jasha. We're doing the preventative screenings. We're still having the same conversations. I'll just sprinkle a little pap smear colonoscopy in there, mammogram.
And I'm not saying that I won't ever start it. It's just that I'm doing, I have a lot of weight loss clients. I love every single one of them. And so I want to spend that time with my preventative medicine with them. You know, when I was talking about medical health coaching, my aspect was thinking, okay, well, I will be a second eye for these people, right? So I will
overlook their
look
plan,
over
make
their
sure they're
stuff.
on code.
Go talk with their primary care provider. But what I'm finding, Courtney, is for one, that's not always going to work. You're not always going to have those primary care providers that are going to even be willing to hear you or work with you.
Especially when you think about their setting. They don't have time to talk to you in between their patient load, and you
That's very true.
So you're going to be getting, reports back or whatnot from their visits from their medical assistant or their office manager or something. So it's such a great idea, but it's probably not very realistic. Do you have a lot of patients that are interested in your coaching that are not weight loss patients, like people that are like, I don't need to lose any weight, but I just want to talk with you, Jasha? Do you have any of those?
I do. And a lot of them, though, want the direct primary care approach,
because they don't want to have to see multiple providers. And that was my dilemma, too, is I had people that wanted to, come and just see me for their healthcare needs. And it's like, you either do it all or none. So you're smart to kind of to stick with your weight loss until you're ready to jump full. But
even if I do, so Courtney, even if I do the medical health coaching, I would still need, the most important thing that we could do is have that conversation with that primary care provider. And the biggest thing that I even wrote it in that blog, in my article, about choosing a primary care provider, because if you have one that is too ego driven to not have a conversation about your health with somebody else that's looked over everything, there's a problem there. And I can't stress that enough. And I agree. I'm not sorry for saying that. It's just the fact.
No, I agree. There should be no reason that they aren't willing to. It's if they can, because, if you think about, say, if you were I know myself when I was in primary care for fee-for-service, if I would have got a call from, myself or you and hey, I've got a patient I need to talk to you about, I'd be like, okay, what's going on? And if it was just let's go over everything, there's no way in the world I would have had time for that, But if it was a quick, hey, I've got her here, this is what's going on, I was wondering if you had any input, that's a lot like a curbside consult, check base, that's easy. But a thorough, what we would need to do, a thorough, comprehensive, let's go down every med, every issue, every complaint, that just takes time, and we're going to have to block out our schedule. And when you're in fee for service, you're not earning any money for the practice or for the healthcare administration, so it's never going to happen.
Yeah. And
unless the patient's there
care
with you
in this area. And I'm sure you do in your area.
Yeah,
Courtney.
absolutely. We have great
ones.
There's
bad in every. I'm telling you, I have my preferred referral list, and I'm not sorry for that either. But it's just about having that communication with primary care providers. And I hope that at some point, even through my weight loss, we discuss what meds you're on. We go over a thorough health history, and we discuss, this would be a good one to come off of, and if there's any primary care provider that's unhappy with coming off of meds with lifestyle, that's the wrong primary care provider too.
Right. Especially if it's safe to do.
Yeah. And I feel like I'm doing it. I love it. And, I'm excited to see how your direct primary care goes.
Yeah, it's going really well. I've got 47 people now, or 48 technically. So I've got my health coaching, which are people who have a primary and they're happy. They like to stay there, but they still would like to speak with me about health coaching and stuff. So I've got 3 of those, and then the other 45 or 44 are direct primary care. So it's going really well, and it's really exciting, and it feels really good to be doing it because it feels good to actually get to know your patients and talk to them. You think it would, everybody who's in primary care or any other healthcare provider that's listening right now, 2 years ago, if you would ask me, hey, Courtney, do you want to spend more time with your patients? I probably would have been like, what? It would have thrown me for a loop, because doing that in that setting would have been miserable, because it was just more, cattle, more cogs in the machine. It was terrible. But now it's like, I see my patients come through the door. I know their name. Like, hey, they bring their kids, we have such a good time, and we laugh about whatever. I mean, half the visit is just like hanging out, so.
Right. And I think for the longest time, Courtney, it was like we were under the impression there is no other way. Right. There's no other way that we can do this. It's just this. Right, and that's why, honestly, even in our areas, because this is new, I'll even how is she doing that? How is that nurse practitioner doing that? She got her own business over there. And it's doable. And just because we're not following traditional healthcare system and how it works, we already see that that's failing. I can say confidently that primary care providers that are listening to this podcast know what we're talking about, Courtney.
Oh, they know exactly.
When we talk
and
about
they're like,
time
oh my gosh,
restraints.
They would probably love to break free with those time constraints and the issues that are rooted in these systems. And we talk about root cause, right? Like, let's fix the cause. It's these healthcare administrations and all the pressure they put. And, I'm so glad I broke free. And the more people that break free and go out and start DPC clinics or, anything to help our communities and our patients that live in our area, and it all starts with primary care, we could really change the healthcare system. I mean, my goal always is to keep people out of the ER. And when people have access to their provider, they don't go to the ER, because a lot of it is reassurance. Like, it's just a cough, it's just a cold, let me listen to you, everything's fine. Or if it's not, you're sending somebody who's actually appropriate for emergency care or urgent care. But DPC, you can do urgent care. I mean, I'm not splinting and, resetting bones in here, but I can take care of minor sprains and, cuts and injuries and any of your common like upper respiratory or UTI. We do the majority of what an urgent care or even the ER see. And so when you have access to that, it changes the healthcare system. So the more people that go out on their own and, get away from traditional fee-for-service, the better our healthcare system will be, the better our patients will be, the better our country will be, our entire population will get healthier.
And see, that is still something that I'm offering my weight loss members. So I'm still doing acute sick visits, and awesome. I'll still see someone, especially if they're a membership on my weight loss program, say they wake up and they're ill. They don't feel like getting out. They don't feel like, doing anything that day. Sure. They can't get into their primary care. We can get on even a telehealth encounter. And so I can see you, because a lot of the times, even through this season, we don't really need a lot of antibiotics. Now, sometimes, yes, when it turns bacterial, but that's with a conversation, right? That we understand the symptoms, what's happening and what's needed. But a lot of the times it's just that reassurance, or, that you need to maybe use something to dry that fluid up. It's fluid buildup causing your migraines.
Absolutely. Viral URI with cough all day, every day, flu season, it's very common, and everybody, and the thing is, a lot of patients think that they need antibiotics because that's what they've been given all these years, right? Because it was easier to give them something and get them out of the door, because I got 25 more people behind you. So, we get to actually educate the patients on what's needed and what this truly is.
And I love giving them that easy access to be able to say, hey, Jasha, you got, and yes, we'll get on the phone. I will take care of you. We'll get that done. That way you're not waiting for a primary care appointment, days sick, where you end up in the urgent care or the ER, where you're surrounded by, say you go in, you got the flu, and you go sit beside somebody with RSV and COVID. Now, hopefully you don't just get
for 3 hours while you're miserable. You're already uncomfortable.
And we've learned through COVID that virtual services work well, Courtney.
They do.
They do work well. Now, there is a time and a place where an assessment needs to happen. I will 1,000% agree with that. But there's a lot of things that we can do virtually that we can keep you out of a doctor's office, keep you out of the risk of getting sicker, and treat you, and educate you.
Yep, for sure. You're absolutely right. And we do the same for most of our patients too. You already know them. You've already gone through their medical history. You've established care. I had a weight loss client of mine recently, can you see me for a sick visit? I can't get into my primary care. Like, absolutely. So it's super easy to take care of those who are, a part of your practice. And when it comes to that unrestricted access, one of the first questions I get from my colleagues are, oh my gosh, don't your patients just bother you all day long? I'm like, no, because they're doing great. We've talked about everything. I mean, you would think my phone blows up all the time, but I mean, you set these boundaries and people know that I'm a human, and I've got a family and children and I'm not available 24/7. I mean, if it's urgent, I check it, and I'll respond immediately. But for the most part, everybody really is very courteous about your time away from work. And even when when I say, hey, call me on Saturday, let me know how you're doing. I'm sorry I'm bothering you on the weekend, and I'm like, I asked you to call me. So everybody, it's not as bad as people may seem. Right. To imagine. So it's really nice.
Well, I love to hear about direct primary care. I'm super excited to see what you do with it in the future, how it goes for you, Courtney. I think we all are. And next time, guess what we're going to talk about?
You tell me. I'm ready for it. You always have
big
something up your
pharma.
sleeve.
It's going to all be about big pharma, maybe a little bit of big food, but we're going to bring in some big pharma and big food because these are things that I really want to hone in and teach our listeners about. We've got to get to the true core problem in the healthcare system, and a lot of that lies with big pharma. And what I'm learning, through functional medicine and when I'm doing my research, it also lies with big food. So we're going to talk about big pharma and big food.
So closely related.
So. I think they work together. They must have like one CEO for both. I'm almost convinced of it. But all right. Well, we will see you next time, Courtney.
Awesome. Happy New Year. I'll probably talk to you shortly.
Yep.
All right.
Bye.